In developed nations around the world, there's a strange and uniquely American crisis that barely makes the headlines anymore, even though it's fundamentally reshaping the lives of millions. Medical debt. It's not a political issue or an economic policy debate that gets debated in election cycles the way housing or student loans do. In fact, most people don't talk about it at all, which is precisely the problem. Every single day, Americans face a choice that people in other wealthy countries almost never have to make. Get the health care you need or go bankrupt. And if you pick the first option, bankruptcy might still be on the table anyway. The thing about medical debt is that it's not like other kinds of debt. You don't rack it up because you made a bad financial decision or bought something you couldn't afford. You get sick, you have an accident, you have a baby or you need surgery, and suddenly you're drowning in bills that you had no way to predict or prevent. It's the most American of problems, the collision between a market-based healthcare system and the basic human reality that we all get sick eventually. The tragedy of it is that this isn't inevitable. This isn't how healthcare works in the developed world. In Canada, Germany, France, Australia, Singapore, and basically every other wealthy nation, you can get seriously ill and face zero medical bills afterward. You don't have to worry about whether you can afford the ambulance ride, or the surgery, or the medication. That safety net simply doesn't exist in the United States, and the consequences are profound. And the numbers on this are genuinely staggering. Medical debt in America isn't some fringe problem affecting a small portion of the population, it's massive. According to the latest data, roughly 41 million Americans currently carry medical debt of some kind. That's about 1 in 8 people. But that number doesn't capture the full picture because a lot of people have already paid off their medical debt through personal bankruptcy, which they had to do to escape the cycle. A study from the American Journal of Public Health found that medical issues were involved in roughly 5% of all bankruptcies filed in the country. That's not just credit card debt or student loans or bad spending habits. That's people who got sick and ended up losing their houses. In some cases, they didn't even need expensive experimental treatments. Sometimes it was a routine cancer screening that went to treatment, or a broken leg that required surgery, or even something as common as appendicitis. The average medical debt that people carry is somewhere between $5,000 and $10,000, but that's an average, which means plenty of people are much deeper in the hole. Some Americans owe over $100,000 in medical bills. And here's the thing that makes this particularly cruel. Many of these people do have health insurance. They did everything they were supposed to do. They paid their premiums every month. They went to doctors who were supposedly in-network. And they still ended up with bills that destroyed their finances. This is happening across all income levels, though obviously it hits hardest for people who are already struggling. The debt isn't just some number on a statement either. It cascades through your entire life. It tanks your credit score, which means higher interest rates on everything else, which means it's harder to buy a car or a house. It can even affect whether you get hired for a job because some employers check credit reports. People start skipping doses of medication they need because they can't afford to fill the prescriptions. They avoid going to the doctor for things that should be routine checkups because they're terrified of another bill. They put off retirement savings, they don't buy homes, they don't start families, all because they're afraid of what one hospital visit could do to their finances. So why does America have this problem when literally every other developed country doesn't? Well, the answer is pretty straightforward. America's healthcare system is built on a fundamentally different model than basically every other wealthy nation. Most developed countries treat healthcare as a public good, something that society provides to all its members. The government negotiates prices with providers, and citizens pay through taxes. People get sick and go to the hospital, and they don't get a bill afterward. It's not perfect in those countries, sure. Healthcare systems everywhere have their own problems and inefficiencies, but at least you're not going bankrupt because you got appendicitis. America, on the other hand, has a private healthcare system where insurance companies, hospitals, and pharmaceutical companies are all profit-driven entities. The incentive structure is completely different. Hospitals charge whatever they think they can get away with. Insurance companies try to deny claims to maximize profits. Pharmaceutical companies charge astronomical prices for medications. And individuals are caught in the middle, expected to navigate this maze and pay whatever they owe. The system creates situations where a single hospital visit can generate bills in the tens of thousands of dollars. An MRI can cost $3,000 in one hospital and $500 in another. The same insulin that costs $300 here might cost $30 in Canada. Americans end up subsidizing the healthcare costs of the rest of the world because pharmaceutical companies set prices based on what they can charge in the United States. It's a system designed to extract maximum revenue from the people who can least afford to lose it. And when people can't pay, they often don't. Hospital bad debt is in the billions every year. The hospitals write it off, and the system absorbs those costs in a way that raises prices for everyone else. It's this vicious loop where unpaid debt becomes an excuse to raise prices further, which then causes more people to be unable to pay, which leads to more debt, and on and on. What this creates is an absolutely vicious cycle. Medical bankruptcy leads to worse health outcomes because people avoid care. Worse health outcomes lead to more emergency room visits, which are expensive, and those expensive emergency visits drive up the debt even more. There's a reason that going bankrupt from medical debt leads to even worse health. Stress and poverty don't help anyone's well-being. People who have gone through medical bankruptcy are more likely to die young, more likely to have chronic conditions that go untreated, more likely to end up back in the healthcare system with an even more expensive problem. It's this spiral that's almost impossible to escape once you fall into it. One of the most brutal aspects of medical debt in America is that it operates almost invisibly. If you talk to people about housing prices or student loan debt, there's this cultural conversation about it. People acknowledge it's a crisis. Medical debt, though, stays hidden. People are ashamed to talk about it, so nobody really knows how bad it is unless they're experiencing it. Hospital debt collectors aggressively pursue people, often illegally, but the public rarely hears about it. Medical debt gets bought and sold on secondary markets, bundled up and turned into assets, and nobody really knows or cares about the actual people behind those numbers. Now, here's where it gets interesting from a global perspective. Every other developed nation has solved this problem. Some with single-payer systems like Canada, some with multi-payer universal systems like Germany, some with public insurance options like Australia. The specifics vary wildly, but the result is always the same. People in these countries have access to healthcare without fear of financial ruin. Yes, they pay taxes to fund these systems. Yes, wait times can be longer in some cases. Yes, there are inefficiencies and problems, but nobody goes bankrupt because they got cancer. Nobody rations insulin because they're worried about the cost. Nobody delays treatment because they can't afford it. The United States spends more per capita on healthcare than any other developed nation. We spend nearly twice as much as wealthy European countries, and yet we have worse health outcomes on almost every measure. We have higher infant mortality, lower life expectancy, and now we have this added problem of medical bankruptcy that doesn't exist elsewhere. Which raises the obvious question: why haven't we fixed this? Why? When the solution seems so obvious, and every other wealthy country has figured it out, does America continue with this system? The answer involves politics, entrenched interests, and a fundamental disagreement about what healthcare should be. For decades now, various reform attempts have failed or been watered down. The Affordable Care Act was supposed to address the problem, but fell short, partly because it was designed to work within the existing private system rather than replace it. Proposals for more comprehensive reform get blocked or derailed. Pharmaceutical companies spend billions on lobbying. Insurance companies fight any change that might reduce their profits. Hospitals worry about reimbursement rates. And politicians, particularly at the federal level, struggle to pass major healthcare overhaul because it's complicated and expensive and involves taking on some of the most powerful industries in America. Meanwhile, the problem just gets worse. Medical debt is growing faster than wages. More people are going bankrupt. More people are avoiding necessary care. More people are choosing between medications and food. And the system keeps churning, making money for some people while destroying the lives of others. Some states and organisations are trying to work around the federal gridlock. There's been some movement on price transparency, where hospitals have to post their charges so people can comparison shop, though that doesn't solve the fundamental problem of prices being too high in the first place. Some non-profits are buying medical debt and forgiving it, which sounds charitable on the surface, but it's really just a band-aid on a systemic wound. Still, it helps real people get out from under crushing debt, so it's something. There's been growing support for caps on out-of-pocket expenses and deductibles to prevent the most catastrophic bills. Some states have looked at negotiating drug prices at the state level, since the federal government can't seem to find the political courage to do it. Vermont has tried moving toward a single-payer system. California has explored Medicare expansion, but all of these are patches on a broken system, not fixes. They're trying to make incremental improvements to a system that, by its very design, produces medical bankruptcy as an inevitable outcome for millions of people. The real fix would require actually restructuring American healthcare so it functions like healthcare in every other developed country. That means either moving to a single-payer system, expanding Medicare to cover everyone, or creating a robust public option that actually competes fairly with private insurance. It means allowing the government to negotiate drug prices the way every other developed nation does. It means capping what hospitals and providers can charge, so prices can't spiral into the stratosphere. It means fundamentally shifting the incentive structure so that the goal is health, rather than profit maximization. Whether that actually happens is unclear. It requires political will that doesn't currently exist at the federal level. It requires voters to prioritize it enough to vote for politicians who would actually push for meaningful reform. It requires that people stop accepting medical bankruptcy as just an inevitable part of life in America, something we have to tolerate. Because here's the thing that's important to understand. This is a choice. This is not how healthcare has to work. There's nothing natural or inevitable about it. Every other developed nation made a different choice, and they're not worse off for it. They're healthier, they're richer in the ways that matter, and their citizens don't have to fear bankruptcy because they got sick. We could make that choice too. We just have to decide that it's important enough to make.